conversation, you have the confidence that you have the right person on board. Daktari, thank you so much for creating time.
Thank you for having me.
And I realize that there's so much that we can speak of when it comes to oral health, you know, going specifically to teeth, going specifically to the gums, to the tongue, and so much more. But today we want to do it a little bit general, just looking at some of the key questions that the people could be having this morning as pertaining to oral health. First of all, our teeth, you know, one of the key things that we always want to understand how best we can take care of, right from that aspect of childhood. This is a random one that I will ask. I remember the other time I was just trying to like tell my little boy, go brush your teeth at night. And there's this friend of mine who visited and was like, you know, that is not good. I can tell you for free. By the time he's 20, his teeth will not be as healthy as you would expect for them to be because he was brushing every day, especially while he was going back to, like he was going to bed. Could you just tell us whether it is wise for us to start brushing the teeth of our little ones from the very tender age, you know, from that first tooth, from that second one, you know, should we start brushing our teeth at their teeth at that level?
Actually, it is.
And this I am asking because I know during our times we really never brushed our teeth, you know.
Okay, it is important for people to brush their teeth at night. And that first tooth, the moment the first tooth is out of the mouth, you should actually visit a dentist. You should take your child to the dentist, visit a dentist so that the dentist can tell you how to take care of those teeth from the word go. You see, the myth about baby teeth, parents say, but hizo zitangoka, like they'll come out, so they're not important, and that's a myth. The baby teeth are as important as the permanent teeth.
Right.
Yeah. So the friend of yours was asking you why you're brushing teeth at night.
Right.
I tell my friends, I tell my patients, I tell people I'm close to, you brush your teeth. You brush at night to keep your teeth. You brush in the morning to keep your friends.
Okay.
Because basically, when you're brushing your teeth at night, it's to keep them because you have food, and the food will lead to bacteria destroying your teeth at night. So it is important to brush your teeth.
Why is it that even as people brush, including these kids, like literally you can see their teeth or their whatever the tooth is pretty much in order, is okay, really no much of decay or any, you know, form of destruction like you speak of. But then even as you brush them, they will still have some essence of decay. They will still have, you know, bacterial infections, as you can tell. I mean, why is it that then if you start brushing your teeth at that very tender age, they do not remain white, they do not remain perfect?
There's another myth about white teeth is equivalent to healthy teeth,
okay,
which is usually not the case all the time.
Okay.
Yeah, so the decay that is present in the teeth from that tender age, it's important to have the teeth, the good health of teeth from a tender age. Yeah. So the teeth that are coming out from a child's mouth at the very young age, we start by using a cloth to clean them. Then as they progress, you come to now starting to brush. And it's not about brushing, it is how we brush.
Okay.
Yeah, it is how we brush. Yeah, what we do not know. Yeah, so how are we brushing the teeth? How often are you changing that toothbrush that you're using to brush your teeth? Yeah. So when you're brushing, there's a method I tell my patients. The teeth are usually contoured in like circular manner. Yeah. So you follow those contours of the teeth while brushing your teeth. And for the babies, they don't know how to brush their teeth. So even for my son, I take a brush first for him, then I'll let him brush after I have brushed for him, because I'm able to reach to areas that they are unable to reach. Yeah, so there are stagnation areas of the molars especially. You hardly get decay on the front teeth, but on the back teeth, because there are stagnation areas, you tend to have decay on the molars.
And that is okay?
No, it's not okay.
It's not okay. So what really then informs this? Because one will tell you, I'm a loyal, I brush in the morning, I brush, you know, during the day, I brush at night. Immediately I'm done taking my biscuits or anything sugary, I have my mouthwash, I will rinse, I will brush. Then why is it that on several occasions or on constant occasions you'll find people having tooth decay? You'll
be surprised that most of adults, or 100% of our population, you might find that each one of us has at least a single tooth with a decay on it. Yeah. So like I said, it's not about the frequency of brushing. It is about how we brush.
How we brush.
So we go to the, let's say the washroom, we take a toothbrush. You just, you think, let me just do this. Yeah. Or the harder I brush, the more my teeth are clean. It's not the harder you brush, it's the technique on which you're brushing. So on the biting surfaces of the teeth where food tends to pack, you need to remove that food from those areas. Yeah, on the outer surfaces, you brush with the contours of the teeth, same to the lower teeth. So you need to touch all the areas of your teeth while brushing. And it's not important to just brush the teeth alone, even the tongue. You must always brush your tongue. Yes, after brushing your teeth. Because if I'm leaving food on my tongue, and my teeth are clean, the food, the bacteria from the tongue will go still to the teeth and they'll still get decay. Yeah. So it's important to brush your tongue also after brushing your teeth. Toothpaste
or no toothpaste, especially for the young ones?
There are fluoridated toothpaste based for the young ones. The fluoride levels in the toothpaste are regulated to serve the purpose of the brushing. So fluoridated toothpaste always.
Always.
Yes.
Is it important to floss, especially for, again, the young ones? And at what points do we floss? After brushing, before brushing? Yeah.
You can brush, you can do your flossing before you brush and then after brushing.
Perhaps to just let people know what flossing is, because not everybody would know.
Yeah, not everyone knows what flossing is. So flossing is basically trying to remove the food in between the teeth, because toothbrushes cannot access those areas unless they're specialized toothbrushes like interdental brushes. Yeah. So in places of dental flosses, you can use interdental brushes. So a dental floss is a thread-like structure that goes in between your teeth and is used to clean the interdental spaces between your teeth, so that you don't get decay starting from those areas, because it's easy to get decay starting from those, and it's a very common area for
there are people who say it's a little bit painful after they floss. Why?
Maybe the manner by which they floss, then the types of flosses they're using. Yeah.
There are some of us who would go to our spring and it's okay, and you floss and you're easy. Is there anything wrong with that?
Yes, there is, because it is not meant for that purpose. And then it will be hurtful to your gums. So the dental flosses are designed in a manner that they're gentle on the gums, so that they don't injure your gum. The thread uzika ya kushona itakuumiza. Yes.
The rinse or mouthwash, just how important are they? Some people will tell you that they move, and I have friends of mine who move with their mouthwash somewhere in the bag. So they take anything sugary, they will definitely get to have the mouthwash and rinse their mouth. Is that really effective in terms of making sure that you're protected?
We say there are adjuncts to the oral hygiene. So the most important way of controlling your oral hygiene is by brushing your teeth. Yeah. So you can use the mouthwash after you brush your teeth, because it's just an adjunct. You cannot replace toothbrushing with the mouthwash rinses. You can't do that. And then also mouthwashes can be used to disinfect toothbrushes. So after you brush your teeth, yes, just you can, after rinsing, you can dip it in the mouthwash and then rinse again to disinfect. Yeah.
All right.
Yeah.
Okay, so you have mentioned something to do with brushing your tongue, which is very, very important. Yeah. And I mean, these are some of the questions that I have received from people when I posted, when I had the poster up. Some asked, is it okay to brush your tongue with toothpaste? And at what point do you brush your teeth? Do you scrape your tongue? Is it before brushing or after brushing or during the process,
During the process?
Yeah.
So in our setup, the tongue scrapers might be a challenge because of our social status. There's low socioeconomic status. So the toothbrushes that we use could still serve the purpose in place of the tongue scrapers. Yeah. So the toothbrushes that you use should have soft bristles, so that when you're brushing your tongue, you don't injure your tongue again. So the cleaning of the tongue should be back and forth and then sideways, so that you remove the food particles on the tongue, and it's gentle. The tongue is a soft tissue, so you don't want to injure it by brushing hard. Yeah.
Just how often should one get to visit the dentist, have the dental examinations?
We should purpose to visit the dentist at least twice a year, intervals of 6 months. Sisi usema mapema ndio best.
Yeah, that's true.
Mapema ndio best. So if you're able to go to the dentist and then we do the dental examination, and then we find something. We might find something, we might not find something, yeah. But it's better if it's caught early so that we can prevent the extension of it, whether it's decay, whether it's gum disease, and so forth, and like that, yeah. So, and then even if you don't have cavities, most people don't know that you're supposed to have your teeth cleaned professionally twice a year, yeah. So it is important to have your teeth cleaned twice a year. Sisi wa Kenya usema mi naenda kwa dentist juu niko na pain, yeah. So most people visit the dentist because they are in pain, yeah, which should not be the case. You're supposed to purpose to visit a dentist at least twice a year.
Okay. How expensive or affordable is that?
In our setup,
when you look at it at the long run, it's pretty much affordable because it saves you a lot.
Yes, yeah, it saves you a lot. Yeah, if you can be able to prevent it, we are targeting preventive dentistry, preventive medicine, because in the long run it is cheap.
Yeah. So some of the early signs that perhaps you are about to experience dental trouble, what do you look at? Is it the yellowing of the teeth, or is it creaming? Is it now the aspect of decay? What exactly would get you understanding that now there is trouble with my teeth?
Common things like pain, which 99% is what brings, 99% of the time, it's what brings people to the dentist, yeah. So pain, if you start experiencing pain in your oral...
Is that at the last stages or maybe the first instances?
The last, towards the last, yeah. So you'll start experiencing sensitivity. It will be on and off initially to hot and cold things. Then gradually it starts being mild pain, then eventually it becomes severe pain that you cannot even sleep at night. Yeah, then we have bad breath that is persistent throughout the day. You can have bad breath in the morning and it's normal, it's physiological bad breath. All of us might have it when we wake up in the morning, but it should not be persistent. Once you brush your teeth in the morning, it should go away. Yeah, so the bad breath, the sensitivity. Then we have pain, I've talked about pain. And then you have bleeding gums. Yeah, bleeding gums is not normal. It is a sign of inflamed gums. Yeah, and so it symbolizes that you should visit a dentist. Yeah.
All right. Well, Daktari, allow us to take a quick short break, and then perhaps come and understand something to do with bad breath, because that is one thing that a majority of people then will suffer. And you know, sometimes maybe it's not because you really have a problem with your mouth, but then just how do you get it off? Like you rightfully put it, you brush your teeth in the morning so you can keep your friends, because you want to speak to people, you know, with this good breath and all that. But it's not always the case. Just what informs this and what could be the remedy of the same after this break.
The home of untold stories. How well do you know what's happening around you? Morning Cafe with heated political debates. Baraza la Siasa.
Hiyo kitu azungumzie, angalie hali ya maisha ya watu.
Informative health discussions. Business, farming. Tasty Wednesday, Fitness Thursday, and Feel Good Friday with amazing DJs, celebs,
waimbaji, kuna comedians, alafu kuna wajinga,
and music bands every Monday to Friday from 6 a.m. to 9 a.m. How well do you know what's happening around you? Morning Cafe with heated political debates. Baraza la Siasa.
Hiyo kitu azungumzie, angalie hali ya maisha ya watu.
Informative health discussions. Business, farming. Tasty Wednesday, Fitness Thursday, and Feel Good Friday with amazing DJs, celebs,
waimbaji, kuna comedians, alafu kuna wajinga,
and music bands every Monday to Friday from 6 a.m. to 9 a.m. well do you know what's happening around you? Morning Cafe with heated political debates. Baraza la Siasa.
Hiyo kitu azungumzie, angalie hali ya maisha ya watu.
Informative health discussions. Business. Farming. Tasty Wednesday. Fitness Thursday. And Feel Good Friday. With amazing DJs, celebs.
Waimbaji, kuna comedians, alafu kuna wajinga.
And music bands. Every
Somewhere
Monday.
in the middle again, I will brush. So you just find that people opt to brush in the morning and maybe later in the evening once they go home.
Yeah. Okay, so bad breath can be physiological and it can be pathological. So it is important to distinguish the two so that you're able to know how to manage the bad breath. The physiological bad breath will go in the morning, will go away in the morning as soon as you brush your teeth, yeah? And you should be able to be comfortable during the day while talking to people. The pathological one needs dental attention, yeah? So that's where you go for professional cleaning, and after the professional cleaning, it should go away. So if it doesn't go away, there are other causes of the bad breath. So maybe it's not a dental problem, it could be an ENT problem. An ENT could be resulting from the tonsils and other things, yeah? So the bad breath, let's talk about the physiological one. The one you wake up in the morning and you have it, you can just brush your teeth and continue with your daily activities. And also in between your activities, you could be sipping water. It's important to be sipping water throughout the day. And then you can chew gum, yeah? Sugarless gum. It also helps.
And so it's really important, because that's really what I wanted to ask you. Sometimes you're told, oh, chew gum, others say if you chew gum, it's even worse. And then gum again is sugary. Most of the people will go for the sugary ones. They do not know, how to access the sugarless, which of course are in the market.
Yeah.
And so most of the times you get to the office that you hear your friends like, ukona gum unisaidie, ukona gum unisaidie.
Yeah.
All this in a bit to make sure that, well, they at least have that fresh breath. What are some of the other things that one can use? And I'm told sometimes you can use dania. I don't know. There's some things that you do a lot of lemon that would be helpful. Is it true, or this remain myths?
Those are myths, and sipping lemon throughout the day is very harmful to the teeth because lemon is highly acidic. Yeah. So because it's highly acidic, it ends up eroding your teeth. You start experiencing the sensitivity. Yeah. So it's not good to sip lemon throughout the day.
Okay.
Yeah. If you're doing lemon, just do it once, maybe in the morning, when you're able to brush your teeth afterwards. Then you can continue with your day without the lemon water. Yeah.
Right.
So the myth about sipping lemon water, using cloves, using dania, and all those are myths.
Okay.
Yeah.
All right. Well, and that aside, we look at the importance of just, going to the dentist, and most importantly, having some of these procedures conducted on you. Just how safe would a dental x-ray then be, and is it necessary?
Dental x-rays are necessary, and it's informed by clinical examination. We just don't send anyone and everyone for the dental x-rays.
Okay.
The clinical examination informs our decision to send a patient for a dental x-ray. So if you're coming and you don't have any signs of cavities, it is not justifiable to send you for an x-ray. Other reasons why we send for x-rays are because of impacted third molars, yeah, and dental cavities that we're unable to see. Yeah, that's why we send for the x-rays.
Okay.
So not every patient is sent for x-rays. It is case dependent.
Okay.
Yeah.
All right. And when you speak about getting to the doctors, also very, very important, the feelings.
Yes.
And, the recommendation, to what level, what is to expect once you get to, visit a dentist, first of all, for checkups, and sometimes maybe when you have difficulties, and then now getting to that level where perhaps they have decided that it would be important for you to have fillings.
Okay, so most people have dental phobia. They fear going to the dentist. But you'll be surprised that dental visits are very friendly. Yeah. So when you're coming to the dentist, let's say you have a cavity, we will take an examination. We'll make you very comfortable throughout the procedure. We'll explain what we need to do or what you are doing so that you're informed. And nowadays, patients are well informed. They'll come having Google stuff, so they'll ask you questions, yeah? And I actually prefer my patients knowledgeable so that we are discussing from a point of knowledge, yeah? Yeah, so for dental fillings, they're done when you have cavities that are not extending to the nerves. Yeah. So when you have, by the time cavities get to the nerve, then the treatment changes from a filling to a root canal. Yeah. Yeah. So let's talk about dental fillings. So dental fillings with, there are very many advancements that have taken place over time with dental fillings. We used to have the silver ones that we no longer, or we hardly use. So nowadays we have white fillings that really blend well with your teeth. Yeah. So even no one can tell whether you have fillings unless you tell them that you had fillings. Yeah. So when you're doing a filling, it depends on the extent of the decay. So if it's too extensive, we might need to numb you so that you don't feel pain or you're comfortable during the procedure. If they're shallow, we don't even need the numbing or putting you through the anesthesia so that we are able to work comfortably. So it depends with the extent of the cavities.
And someone is watching and asking, how safe is it then to clean at the level of the dentist? Because, I mean, there are always fears of, it would literally scrap off the ethanol.
Okay, so the cleaning, it's another myth that I was to talk about. So most patients or most people think cleaning scrapes off enamel, scrapes off the surfaces of the teeth, and it's a myth. When you are cleaning, we are not scraping off the enamel surfaces, we're just removing, let's say, the tartar, the stains, and it's safe that way. So if you're able to go to a dentist, and it's because people don't know or cannot tell the difference between a dentist and other people. Yeah. So we have other cadres in oral health that they provide. Yeah. So the other cadres, we have cohos, we have dental technologists, like that. Yeah. So it's important to know where you're going.
Right.
Because if you go to someone who is not a dentist, let's say it's a quack, you might end up having that scraping of enamel because they want to make your teeth white, because that's what you told them you want. And it's important to also distinguish that whitening and cleaning are two different procedures. They're not the same procedure.
Why the sensitivity, even for those ones that have visited professionally, professional dentists?
Okay, so you might experience sensitivity after cleaning, and I tell my patients that. And the sensitivity is because the level of the tartar, yeah. So if you have tartar or calculus or the hard stuff, the hard stuff that forms on the surfaces of the teeth, once you remove it, you expose the root surfaces, yeah. So those root surfaces are exposed into your oral environment. Yeah. So when you're taking cold or hot things, you might experience sensitivity for a while, 2 days, 3 days, and it will wear off. Yeah.
All right. Well, there are those ones that have these silver teeth, for beauty.
Yeah.
Just how safe are they?
It depends. Some people come and say, oh, Daktari, I want this silver tooth. I want this gold tooth. Yeah. So if it's done professionally, it's okay. You can have it because there's not much reduction done to have it. Just go take measurements of the tooth and have it done nicely. Yeah.
Nick is watching, and he's asking this question that there are so many of us who really, after taking meat, any forms of meat, you find yourself, with toothpicks, and there's that enjoying moments, where you just want to literally try and poke your teeth here and there. It's a feeling of enjoyment, but also comes with some essence of risk, because there are instances where you find that you're bleeding. What really informs this, and just how dangerous would it be, and how can one get themselves out of that?
It is dangerous to use toothpicks because I have had cases where I've had to remove toothpicks in between the teeth because yes, they broke there. So when you're having meat or fish, whatever you're having, and then it's you feel like it's stuck in between the teeth, that's where the floss comes in. Yeah, the floss is important in such scenarios or in such instances because it's friendly even to remove the pieces of meat that are stuck in between your teeth. Yeah, the toothpick will end up injuring your gum. You'll have inflamed gums. You'll be uncomfortable. You'll have discomfort throughout the day because your gums will be swollen, and it can be pretty bad. Okay,
in the quest to fix your teeth and smile and look good, and after the fillings, just what do sealants do?
Sealants are used to prevent dental cavities. So we usually say high risk patients when you're assessing. Yeah. So when you're assessing a patient and you find, let's say they have cavities on their first molars, especially babies, or they have deep fissures on the molars. So those are high risk patients because the deep fissures can act as stagnation areas for food, then they lead to cavities. So sealants are done on high risk patients you feel like they're going to have decay or they're at a high risk of getting dental decay. Yeah.
I don't know whether you've encountered these kids really that do not have their teeth shaking, and before you know it, there's another one that is growing from behind.
Yeah.
And so on several instances, they are not even telling their mom that I feel like my teeth is or my tooth is shaking, and therefore we might need to have it out. What happens in such a case, and how do you handle that as a parent? Because before you know it, it's another tooth that is coming out without having.
Okay, so the baby teeth are usually predecessors to the permanent teeth.
Yes.
Because they guide the permanent teeth into the mouth. So most of the time you'll find that the permanent teeth will displace the baby teeth so that they can come into the mouth. But there are scenarios where that is not the case, so they end up growing in a different position. Yeah. So if you realize they have grown in a different position, you take your child to the dentist so that the other ones can be taken out
Immediately?
Yes.
And it's fine. And these other ones will find their position back?
Yes, the tongue pushes the teeth back into their position. It's in a growing child. Yeah, the child is still growing, the jaws are still growing, so eventually the tongue will push the teeth into their position. And then you cannot assess the malalignment at that point because the worry of the parents, like no, let the child grow until they are 12, 13 years, so that you're able to assess properly once all the teeth are
think of braces.
Yes.
Okay. All right, so that really is in order. But for such parents, is it always important that then you constantly visit the dentist because you literally do not know when it's coming?
It's important for every parent to purpose to visit a dentist.
Okay.
Yes. So
that would help also?
Yeah, that would help. Yeah. Because you're visiting the dentist twice a year, we are able to catch such things early. Yeah.
Okay. Plastic teeth.
Yeah.
They're pretty much common. And I don't know why I'm always keen on getting to understand, the development of teeth for kids. Yeah.
So the plastic teeth are the teeth that the young babies are born with. Yeah. And in where I come from, they say it's a bad omen. They consider them bad omen. Yeah. So the plastic teeth can be, it's like a shell. Yeah. So you assess the babies if they have the plastic teeth, and see, because sometimes they can be a hindrance to feeding, they can be loose and the child might swallow them, so they need to visit a dentist so that they can be sorted out. Yeah. Are
sweets and ice creams and all this sugary stuff as bad, really?
I think it narrows down to your oral hygiene practices. Okay. But highly sugary foods are not good for your teeth, because the sugars can be used by the bacteria to break your enamel, then cause caries, and that's why we advise against the sugary things. So for children, when they come to the clinic, I tell the parents that they should just be used on special occasions like birthdays, when they're being treated once in a while, because the sugars are not good for the teeth.
The irony of it all is that you'll be told, take sugar cane, it will strengthen your teeth. It will even help to brush, the roughness and all that, because of the fiber it holds. Catch-22 in this case. So this is sugar cane that has lots of sugar, and I'm advised to take because it's a fruit. But on the other side, I'm told do not take sweets. I mean, is it not a bit confusing?
It is confusing, but then the sugar cane, you're told it's because of the chewing of the sugar cane that it's presumed that it's helping in brushing teeth. Yeah.
And is it not sugar anyway, after all?
It is. It is sugar. The challenge with any sugar things, even the ugali we eat, at the end, if you break it down, you'll come to sugars at some point.
Right.
So it's how you brush or how you maintain your oral hygiene that is of importance. Yeah. So the sugars in everything, the sugars in ugali, the sugars in sugarcane, the sugars in sweets, they are used by the bacteria to destroy teeth. So that's the bottom line. Yeah. So the bottom line is you need to brush your teeth after having any any sugary thing.
Okay.
Yeah.
Let's talk water and teeth.
Yeah.
The salty water, I'm told, wengine wanasema tumetoka hiyo side ya
Yeah,
Naivasha, na sijui wapi. And you see, the most unfortunate thing is that today in the country, it's on rare occasions where you're going to go to a place and get them having fresh water, 100%. Ile maji tunaita ya kanju. Today it's salty water,
so rare
and out. It's so rare.
Yeah.
So for you to get to enjoy fresh water, you have to buy.
Yeah.
But you do not want to tell me that you're going to buy water that you're going to use for cooking
It's not
and other
sustainable.
activities. Just what is this that is about, salty water that gets people having, dental problems and tooth decay for that matter?
Okay,
Discoloration.
It's actually highly fluoridated water. The highly fluoridated water is most.
So fluoridated, again, is fluoride?
Yes.
And at the same time, teeth would need fluoride?
The fluoride in the toothpaste is regulated to a certain level so that it's used to prevent teeth.
Okay.
We're talking about excessive fluoride in water, yeah? So the excessive fluoride in water is not good for the teeth because it ends up causing dental fluorosis. Yeah, so it's become a menace lately because there are very many children with the brown discoloration of teeth, and it ends up affecting their esteem, the decay and everything, yeah? So even children come to the clinic, like at Prestige Dental where we see babies, they come and they're like, mamake anasema anashindwa kuongea, like she's so shy, amefika ile age yenye anajielewa, and now children at school are laughing at them. Why do you have brown teeth? You don't know how to brush your teeth. So they tell babies that. So the brown discoloration results from highly fluoridated water, and it's important to know that fluorosis can only occur in children, yeah, in babies.
Okay, I mean, does it affect every child differently? Because there are people who are in the same environment, grown, raised in this very environment, but you find that maybe they don't have, they don't have discoloration, decay, and all that. But there are others who literally are affected. If you're
really keen with the fluorosis, it has different categories. Yeah. So we have mild, we have moderate, and then we have severe. There's a score for that. Yeah. So in mild fluorosis, you may just you might not even be able to tell. Maybe it's small lines, small brown lines, or white teeth, white patches here and there on the teeth.
Yeah.
Yeah. So fluorosis is graded differently. So you have mild, moderate, and severe. So in mild fluorosis, it might not be noticeable and it can be ignored.
Yeah.
In moderate, there are things that can be done to correct the fluorosis.
Okay.
Then in severe, the treatment again is different. So the treatment modalities for dental fluorosis are different. So when you're living somewhere, it's important to have the fluoride levels in water checked so that you can take the preventive measures. And then you'll realize sometimes you might be living somewhere where we have high fluoride water, then at some point you shifted and moved to another place. Yeah. So the teeth that were being formed at that point in time are the only ones that are going to be affected by the fluorosis. So you'll find maybe these two central teeth have fluorosis, the rest don't have, because you moved at some point, before the other teeth formed. So it usually affects teeth at the formation stage. At
the formation stage, even before they are out?
Yeah, even before they're out.
Maybe I should ask this, that does it then affect the other, say, organs or parts of the body? Maybe the bones?
Yes, the bones.
It does?
It does. We have skeletal fluorosis, and the high fluoride levels can affect the bones.
Oh, okay. It's a bit scaring. But then again, if you realize that the water has been tested and you realize that the levels are extremely high, what to do?
We have defluoridators. You can get defluoridators. And there are people who are specialized to do that. So you can get defluoridators. The water can be going through them so that you can be able to get water that you're able to use.
Okay.
Yep.
All right. The sensitive teeth, I know we've mentioned it at some point in time, after you've gone to the dentist, but there are some people who have sensitive teeth even before, perhaps they get to see the dentist and all that. How do you manage this? Because the instances one will tell you, you need majibaridi. And sometimes you even see some type of material and you feel like it's pretty much, affecting you. Yeah. Some will tell you that is extremely hot water, I cannot manage and all that. Just why do people get to have such experiences, and how does, one get to manage?
Okay, so the management of sensitivity of teeth is dependent on the cause of the sensitivity, yeah? So sensitivity can be generalized or it can be localized. So if it's localized, it can be because of dental caries, it can be because of receding gums, it can be because of trauma to the teeth, yeah. So sensitivity is basically handled depending on what the cause is. So if it's decay, you do fillings on teeth. Yeah, if it's we have periodontal disease, which is basically gum disease. You treat it by doing scaling and polishing and other treatment.
Okay. Yeah. Are there dental cases, you know, decay and health, oral health problems that are hereditary? And I think I've literally seen people, you know, like from the mother to the son, you know, you realize that how their dental formula is almost similar sometimes. Yeah, pretty much the same. In this case, would you say it's hereditary?
Dental caries are not hereditary.
At all?
At all. Dental caries is a multifactorial disease. So basically, you cannot say that the mother passed dental caries to the child through birth. No, it can't happen. Yeah.
Martha is watching. She says that in her family, all the female have an extra tooth on this jaw, on one side. You know, like the way you perhaps would have another one here. Yeah. When the Kikuyus will call it ngai. Is it ngai? No, not ngai. There's a name that they use. I can't remember so well. But yes, how is that possible if it's not hereditary? You know.
Oh no, there are dental conditions that are hereditary. But the dental cavities, the
cavities are not.
They're not.
But what are these ones that are hereditary? These conditions that you speak of?
Excessive teeth in the mouth.
Okay.
Yeah, they can be genetic.
And someone cannot do anything about them.
You can do anything.
You can do something, yeah.
So if they're excess teeth, you can extract the excess teeth. Because you take an examination and see which ones are in line and which one is out of line. So the one that is out of line, you remove it.
How safe are these processes of whitening the teeth, the veneers and all that?
If they're done professionally, they're pretty safe. But then not everyone needs veneers. Okay. Sometimes even when a patient walks in and they're like, I want veneers, you assess them, you're like, no, you don't need veneers. Your teeth are just fine the way they are. Yeah. So they are safe if they're done professionally. And then there are other methods of whitening teeth. We have bleaching. We have the veneers. Yeah, and other methods. Yeah. So you can do such things to whiten your teeth.
Your teeth. We come to the gum and perhaps start with this question, the artificial teeth, and especially for the oldies and those ones who've perhaps had, have lost their teeth and therefore they have to get the artificial ones. I am told care is extremely difficult and sometimes, then they say they bring lots of bacteria or more bacteria depending on how they're taken care of. Just how safe are they?
Those are called dentures, the plastic teeth in quotes, or the artificial teeth. So the dentures are used to replace missing teeth, and they can be partial or complete. So in partial is where you have other teeth in the mouth but you lost others, so you get teeth to replace the ones that are missing. In complete dentures, you don't have any single tooth in your mouth, so all the teeth are artificial. So the dentures, when you're giving the patient, they can harbor a lot of bacteria if they're not taken good care of. Yeah. So there's a way you clean the denture. We educate our patients on how to take care of the dentures. And you can find a patient staying with the dentures for 10 years, 15 years, and they're okay, provided they follow the instructions, the post-insertion instructions. Yeah.
Gum care.
Yes.
Very important.
Very important. Yeah. So gum care is basically involves the cleaning of your teeth, your brushing. So the cleaning of your teeth can be you yourself doing the brushing, which is what we advise patients to do. Brush twice a day, in the morning and in the evening. In the evening is important to brush after you've had your meals, yeah, before going to bed. Professionally, it should be done twice a year. And the importance of doing the cleaning twice a year is so that you remove the tartar. And the tartar is the major cause of gum disease. So the receding gums, the inflamed gums, and such things. And then you can also use a mouthwash after brushing your teeth to help in gum care.
These upper parts of the mouth, generally, up here, and the gums, the sensitive bits, how does one clean them? Because literally brushing is a bit uncomfortable.
Yeah. So that's you can use a mouthwash to do the mouthwash.
They do the cleaning
rinses.
and the tongue as well.
Yes.
Yeah. All right. Let's talk about some of these substances that we use. I don't know whether it's a substance or what we'd call it, but bicarbonate of soda. Sometimes you're told that, oh, use bicarbonate of soda, it will help whiten your teeth. Peroxide, and I've personally used peroxide at some point in time. After that, you're done cleaning or brushing, you gargle with it. I've personally used bicarbonate of soda. Do they really work?
They are substitutes. The hydrogen peroxide is used to make mouthwashes. It's a component in mouthwashes.
Okay.
Yeah? So you can use them to, most mouthwashes have betadine, chlorhexidine,
So when you brush with your mouthwash, do you have to use again a peroxide, or you can just do peroxide and that's it?
You can do, no, you need to brush your teeth before doing the mouthwash rinses. Yes, it's compulsory for someone to brush their teeth. The mouthwashes are not substitutes to brushing your teeth. They're just adjuncts to help you clean the areas like the soft palate where you're saying you can't brush. So when you're doing the rinses, you're also cleaning the other parts of your mouth. Okay.
And when talking about health generally, you're always told the lifestyle is very, very important. The things that you eat are very, very important. Just what are some of the foods that are good for your teeth, if at all there are any? The nutritionist will tell you vegetables are good. What? Is there any that we can really attach to, having good teeth?
Not
really
necessarily, but highly fiber foods. We say calcium-based food. So there's this myth about calcium. Tukikunywa maziwa unakuwa na meno white. No, it's just, I think a balanced diet is good for a balanced health and overall health.
Well, that's amazing. One more thing before we go. There's some of us who think it's beautiful, but it's actually beautiful. I don't know whether you've met these people who don't have like this tooth here, and they smile, and it's such a beautiful thing. I've personally seen one of my friends saying that they have to remove this tooth, so at least they bring out that beauty. And true to it, they have done. This aspect of forcing the tooth out, just how safe is it?
It is not safe to lose your permanent teeth or your tooth for beauty, I think, because if you're losing, especially this corner tooth that you're talking about, it gives form to the mouth, or the shape of the mouth. So it gives that contour, the corners. It's supporting the lips, the cheeks, and whatever. So if you're removing that tooth, you're going to have collapsed cheeks, collapsed, and then losing a single tooth has like a ripple effect. So you lose this tooth, others start moving. So when others move, they create gaps. Then you don't bite well. So it has other effects that are not, I think, nice. But they're not worth removing a tooth for beauty.
This removal of tooth for the young ones at home, is that okay? Or perhaps when you want to remove, it's always advisable to go to the dentist?
We encourage parents, if they're able to remove from home or at home, better.
Well and good. Asante sana, Dr. Mary Akumu. Lots of questions, but then time would not allow for us to go through them, but we are grateful for the ones that we've managed to pick. Looking forward to have you some other time for more and more of this discussion about oral health. Thank you so much. It's always, a beautiful thing to be able to come out there and smile and, just have the confidence, wear that smile with the confidence that you're looking good. And so if you love yourself to that level, please, like Dr. Akumu would say, it's important that you have constant visits to the dentist. Twice a year, pretty much will do you wonders. Let's close this one. Not in totality, we still have so much lined up for you right here on TV47, so don't turn that dial. My name is Linda Alela. For me, I get to see you again tomorrow, same time. Bye-bye.